Breast augmentation mammoplasty involves introduction of an implant to create or increase the shape and the size of the patient's breast so that there is a balance between the patient's breast and the rest of the body. So most of the patients who require breast augmentation or who want breast augmentation are patients who have breasts which are small in size and not in sync with the rest of the body, or patients who have had certain congenital abnormalities whereby one of the breast sizes or both the breast sizes are asymmetrical. We also use the breast augmentation procedure to reconstruct breast in patients who have lost breast because of cancer. So it has got a wide range of applications including aesthetic as well as reconstructive surgery. There are basically two types of breast implants. One is a silicone filled breast implants which are filled with cohesive gel, and the other is a saline filled silicone implants in which saline is introduced into an elastomer shelling. So both these implants are used, but the most commonly and the most popular are the cohesive gel fill implants because the feel, the texture and the nature of these implants is such that it mimics a natural breast. This is basically a daycare surgery. The patient undergoes the surgery and gets discharged the same day. Patients are prescribed certain antibiotics and painkillers. There is a dressing in place which needs to be seen on the 3rd to 5th day. So the patient is called on that particular time period, and once the dressing is changed, the patient is put into either a compression garment or certain form of dressings, and then the follow-up actually happens at about 10 days, then after about a week, followed by at a month's time. Following that, the patient is regularly seen at 1 monthly interval for a period of 1 year so that any untoward complications or side effects because of the implants can be managed. This is one of those surgeries where there are very predictable results and uniformly very low complication rate. So the risks involved are very minimal. They can include developing bleeding into the implant or inside the breast. Rarely infection can happen, but both these complications are less than 1 to 2% of the total cases we do. The other complications which can happen is the patient can have malposition of the implant because of faulty surgical technique, or the patient has not been assessed properly pre-operatively. The other complications called capsular contracture happens frequently. It is supposed to happen in 15 to 30% of the patients, but in most of the patients it is asymptomatic. Rarely we may need to intervene and do some surgery to correct severe capsular contracture, but these are complications which are all manageable. The breast implants per se do not prevent the breast from sagging. In mild sagging breast, the implants can actually uplift the breast, but over a period of time, because of the weight of the implant, the breast can actually droop down. So in case the patient has come to us just to correct the droopiness, we have to combine another procedure with it that is called as reduction mammoplasty or a mastopexy along with augmentation. Normally the shelf life of a breast implant once it is inside the patient's body is about 10 to 12 years. That is what the manufacturers recommend, but these patients undergo frequent checks at regular intervals. We have seen patients who have undergone breast augmentation and are very comfortable and living a healthy life even 12 to 14 years post-surgery. So the normal shelf life or the life of the implant inside a patient is about 12 to 14 years on an average. The basic nature of the surgery is that the implants are put behind the breast. So it does not in any way interfere with the patient being able to breastfeed. We are not violating the breast tissue and no ducts are cut. This is a myth which has been carrying on for a long time. Many studies have disapproved it vehemently that breast cancer does not happen because of the implants, because there is no correlation between the two. The amount of and the type of product which is being used is not carcinogenic, but one has to understand because of the large number of patients undergoing breast augmentation, some patients may develop breast cancer as a part of the general population. So this is just a coincidence that patients who have had breast augmentation also had breast cancer. So we have seen that once the patients have got the breast augmentation done and once the patients find that everything has settled, the scars have softened, even for us sometimes it is difficult to make out whether the patient has had a breast augmentation or not. Because of the soft cohesive nature of the gel which is there in the implants, it actually mimics and becomes a part of the breast tissue. So patients can carry out most of their activities in the same way in which they were doing earlier. So in no way does it hamper with the normal physical activity or day-to-day physical exertions which the patients can do on a regular basis.